Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show. Welcome aboard. This is the Veterans Impact Show. I'm Jim Blythe, U.S. Navy veteran. Joining me, Cedric White, my co-host, minister, marriage counselor par excellence. If you're in the military, you know that you weren't supposed to have a wife unless they issued it to you. So it's very problematic about being married in the military, and that carries over to our civilian lives as well. Cedric and his wife, Michelle, are so incredible at talking about that. And it goes along with what we think about, what we talk about, which is help, hope, and healing, right, Cedric?
Exactly.
Okay. And today I've got a very, very special program. I'd like for you to meet Dr. Kushwaha, who is regenerative medicine. He's an amazing guy. He came so highly recommended, and I've enjoyed talking to him. So, Dr. Kushwaha, tell us a little bit about your background, please.
Absolutely.
What you
And
specialize.
thank you for having me on your show. So I am board certified internal medicine and actually obesity medicine as well. I've been a physician for a little over 30 years now. Um, about a little over 10 years ago, after doing primarily traditional medicine for quite some time, I took a special interest in regenerative medicine, primarily looking for treatments that we didn't really have good treatments for. We have a lot of conditions where, frankly, modern medicine does a really, really good job for, and we've got conditions where we really, really do not. So trying to kind of explore what we could do from the things that we didn't traditionally do very well. What other treatment modalities, whatever type of treatments we could come up with, so we could really take care of more conditions altogether. And that's been kind of my passion project over the past several years.
Now, a lot of people, especially military, pain management is a big thing. So, pain management has been primarily opiates, right? Oxycodone. And all that does is, I think, mask the inflammation, mask the pain. What are some of the things that you have looked at? Because I know you've got some experience with this, and we'll talk about some of these modalities that you're talking about.
Absolutely. So, treating a pain condition with an opiate, you're right, that literally masks the pain. It does not do anything to actually fix the underlying condition. So, to properly take care of the pain condition, we want to see what the disorder is, what's the source of the pain, and try to go straight to the source and correct that. And of course, there's times when we really can't fix the underlying problem, but there's better things we can do than just kind of mask it so it doesn't exist. If we've got an acute injury or even a chronic injury that's been causing dysfunction for a long period of time, we want to use the treatments we have at our disposal in regenerative medicine. So, what's regenerative medicine? These are treatments that use the body's own healing properties to fix and correct problems. If the body can do it, how come we got the problem in the first place? Well, as you know, it's complicated. There are a lot of things that can happen, and it's really amazing to see what the body under normal circumstances, what it's able to tolerate, what it's able to overcome. Unfortunately, through the course of what humans do in day-to-day activity, it it may be more than what your body is physically capable of taking care of on its own. And that's why we have doctors. That's why we have these treatments, basically to find healing strategies. So with regenerative medicine, primarily we're trying to locate the source of injury, and then we're using these compounds that come directly from your body so that we can activate, we can um, enhance and begin the type of healing that you can't just do by yourself. So There are a number of different type of regenerative treatment options. We've got things like platelet-rich plasma, which are utilizing growth factors derived from your own platelets. We're concentrating them, we're activating them. We've got traditional stem cells, which are a specific type of regenerative cells that come from birth products, primarily the placenta, the umbilical cord. And then we have a newer generation of treatments, which are exosomes, which take basically the healing aspects of stem cells, concentrating them. So we're using basically all the growth factors that are involved with stem cells without actually using cells.
So how do you get the stem cells? Or do these come from like you take blood, you take these from our bodies somehow, or do you get them from an outside source?
So there's different ways of deriving these stem cells. You can derive them from your own body, primarily from bone marrow or fat tissue. Within fat layers, you do have a specific type of stem cells called adipose stem cells, and you've got active stem cells within your bone marrow. The problem is, as you get older, every decade of life, the stem cells become less and less active, and they're able to divide less and less, which means there's less healing property out of them. So that's why when you're 5 years old, you heal really, really quick. When you're 15 years old, you heal pretty good. When you're 25, it's still pretty good. When you're 70,
Not so
there's no
much.
comparison. There's a huge, huge difference as far as how much activity you're losing. So the most effective stem cells that we have are actually coming from neonates. So that's why we want to use placenta, we want to use umbilical cord tissue, because those are basically year zero. It's about as active as it gets. And just to clarify, we're not actually using any fetal products here. Those are the wrong type of stem cells, because fetal stem cells, beyond just the moral, ethical issues with using fetal cells want to turn into a fetus, right? So if you take fetal stem cells and try to use them for anything, they really want to turn into a fetus, which is not what we're trying to do. We're trying to heal tissue, not create a new entity.
Right.
So when you look at placenta and umbilical tissue, what do those cells want to turn into? They don't want to turn into anything. They've
Right.
got one job. Their job is to support, nourish, heal, and protect the developing fetus. So they don't want to divide into new creatures. They don't want to do any of that. They want to make sure that the tissue that's adjacent to it are as healthy and strong as possible. That's what we want.
Really?
So traditionally with the regenerative treatments, we want those type of stem cells. And what's been done for many decades is we're harvesting those stem cells from placental material, umbilical cord material, and we're putting them in a lab where basically we're growing them fat and happy, so that way they're going to be as active as possible when they're ready to get to work.
So, Dr. Kushwaha, you've been in the industry for over 30 years, right? Um, Surely you can't come up through traditional medicine. What made you want to start looking at more of the non-traditional or even just different aspects of treating your patients?
Well, again, because of many, many conditions that we just did a poor job treating. So to give a little bit more background, I'm actually a military dependent. So my wife was military when we started this journey. As soon as I got out of training, we were stationed in North Carolina.
Okay.
And instead of setting up a traditional practice, I decided to be what at that time was a somewhat controversial field of being a hospitalist, where if you're admitted to a hospital, there was a doctor that specifically took care of you there. That
Okay.
wasn't your primary care physician. And that doctor would be very adept at treating, high complexity sick patients, because all my patients were in the hospital. These were not minor conditions, and they span the board from, pneumonia to meningitis to heart attacks, strokes, and everything in between. So very high acuity.
Mm.
And a lot of these treatments, like I said, we would, you come in with pneumonia, even, with abscess and sepsis, we could fix you. We could get you better. And we could have you walk out of the hospital when you were literally on, your deathbed coming in.
Mm.
So a lot of things we did really well. A lot of things we really did a terrible job. So there's um, and specifically chronic pain type conditions, we did a very poor job with either because the underlying condition, let's say it's a damaged nerve, um, you have a short period of time to correct the problem or you get sort of a permanent injury. Once the nerve's damaged and you've missed your chance to kind of reverse the problem, that nerve is always going to be very, very irritable. It's always going to cause problems. You're always going to have pain.
Okay.
And after the fact, you have very limited options. So the traditional medicine way of dealing with that is, okay, we use pain medication because that's what we do for pain.
Right.
Since that time, we've developed a lot of other treatments that don't involve narcotics and other medications that can actually do more harm than good, while at the same time restoring the normal function. I don't know if you all have had chronic pain. Um, I
Yes.
know. So, it changes your personality. It
Yeah.
changes your life. It makes you irritable. It makes you hard to deal with. It makes you angry
You sound
because,
like my wife. I'm sorry. But-
Angry old man.
yes,
There's especially among military where people did stupid things like jump out of perfectly good airplanes, or
absolutely.
we're on aircraft carriers, or we're on missile cruisers,
Yes.
or
Yes.
whatever. And I think that there's a lot of that because one of the things that I have learned in volunteering with Symbios is that when you have a traumatic injury, when you do something or you're in a traumatic situation, maybe you weren't physically injured, there are changes that go on in your body. Your body rushes certain chemicals and things through your body, and you begin to change not only your brain functions, but your body functions. I have heard that and read that in books about this. I'm by no means understand it all, but these things change your chemistry. And so what you're talking about are things to reverse this chemistry. Can
Absolutely.
you
So what you just described was very, very well put. So your body's trying to heal and repair, and it undergoes a major change that affects literally every cell of your body in response. But unfortunately, it's still not fixing the underlying problem. So you get a layer of dysfunction that is trying to make up for the initial problem, the initial injury. And that layer of dysfunction causes more things to get out of whack, which cause an additional layer of dysfunction. Now we get layers and layers of dysfunction that causes all kinds of issues. So we're not even talking about the same, you know, organ system now. We're talking, it literally affects every part of your body now at this point.
the total body healing?
Yeah.
One of the things that Dr. Ashmore, who's got Symbios that I volunteer with, explained to me that when you oxygenate the blood in the body and you increase the blood flow, it has an impact on the hypothalamus. I'm not sure I understand all that. I'm not a doctor, but as I understand it, the hypothalamus produces chemicals, endocrines, whatever, that help in the healing process. And so when you oxygenate the body as well, that helps an inflammation. Is that, can you explain that?
So that's part of the system. So hypothalamus is right next to your pituitary gland, and pituitary gland, that's the master hormone gland, right? That controls literally every hormone in your body. The hypothalamus works kind of alongside the pituitary gland. So anytime you've got these major areas of dysfunction, that area is going to be out of whack as well. That's why chronic pain causes low testosterone in men, for example. be part of this dysfunction. When it's not quite as simple as that, you need more oxygen, because more oxygen makes everything all better. We Increasing blood flow not only increases oxygen, but it also increases all the raw materials that each of these tissues need to adequately heal. So going back with the regenerative medicine part of what these growth factors do is they enhance blood flow to the area. By enhancing blood flow to a damaged area, you're bringing in oxygen, you're bringing in amino acids, you're bringing in the cofactors that are necessary to build and repair. Otherwise, without that ability to move that material in there, you have a damaged area that has no access to resources. So if you think of you're trying to build let's say you got a huge barn in a very rural area that burns down, and you want to build it back up. Well, you're kind of limited to just what's around. Now, if you had a forest fire that just wiped out everything, how are you going to rebuild that barn? You got no raw materials. So by using, and there's multiple different types of treatments that we use, but by using some of these treatments, what you're doing is you're basically building a road that now brings those resources directly to where you need it. Now you can bring in the lumber. Now you can bring in, steel brackets. You can bring in the screws and nails and everything else, so you can rebuild what was damaged.
That is a great way to describe it and describe what's going on. Now, for instance, I had an accident on a horse many years ago. Very, very little cartilage, if any at all, left in the left knee. Painful situation frequently. And so I had the first, I think, of what was it, the stem cell deals,
Yeah.
and it worked for maybe 6 months, and then it didn't work. What I found out was that if I had had something like a class 4 medical laser or something like the neuropuncture that would have stimulated the total body, then that stem cell treatment may have worked a lot more effectively. Is that true?
Absolutely. When I'm using, I don't really use stem cells anymore, so it's primarily exosomes. But when I'm using exosomes, when you use a class 4 laser, that enhances the blood flow. So that way you're getting all those raw materials. Now you can maximize the utility what those growth factors are trying to do.
Well, I'll tell you what, let's do. We're going to take a break, hear from all of our partners. We want to especially thank the Hope Center for giving us the opportunity to use this facility. We also want to thank Symbios, ccn.com, and Symbios Plus, which Dr. Kushwaha is now working with. And we want to say very much a thank you to Fairway Independent Mortgage, who I work with. So we're going to be right back after these words. We're bringing you help, hope, and healing. This is your Veterans Impact Show. We'll be right back. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Hearts Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. Hey, welcome back, Jim Blythe and Cedric White. And we were saying a special thank you for our sponsors. And Healing Thine Hearts is an amazing organization that helps veterans and active duty military because it's your organization.
That's it.
And it is a 501c3. If you want to know more, go to healingthinehearts.com.
.org.
I'm sorry. Excuse me, brother. And it's important because what we believe in is total body healing, mind, body, and spirit. Now, to get back with our discussion with Dr. Kushwaha, a regenerative medicine specialist, an amazing discussion we're having. So let's now talk about, you talked about stem cells, you've talked about exosomes and what they are, but we're talking about how you can integrate, which is what integrative health is about, other modalities that will help those things to work. So one of the things I talked about, which I have, is a class 4 medical laser. When you put light energy into the body, it stimulates those stem cells. It stimulates blood flow in the area. And you're familiar with having a class 4 medical laser, I believe.
Absolutely. Yeah. Certainly after doing regenerative treatments, when you use the class 4 laser immediately following, yes, you're activating, if you're using stem cells, you're activating the stem cells. So they're going to be as active as possible, but you're laying the foundation. The tissues that have the injury in it, you're enhancing blood flow to the area, or you're enhancing nutrient and resource flow to the area, and you're getting the tissues that you want to build on already ready, so that um, the growth factors you add are going to be more effective.
Absolutely. And the same thing, I believe it's called PRP,
Mhm.
where they use your blood platelets and they spin them in a centrifuge.
That's correct. What you're doing with PRP is you're concentrating and enhancing the growth factors that are naturally inside your platelets. So your platelets basically are your first responders. If you cut your hand, you cut your arm, or whatever, you're not going to bleed to death. The reason is because you form a clot, right? And that starts with the platelets. So most people realize your platelets initiate that clot, but what most people don't know is the platelets actually have pretty significant growth factors in them. So not only are they starting the clot to stop the bleed, but they're already starting a healing response. And that's one of the reasons why, if you cut your finger, usually a day later, you got a pretty good seal already. And in a lot of cases, in most cases, in a week, it's pretty much back to normal.
What I have experienced, what I had early stages of prostate cancer. I had a heart attack years ago, although I'm able to maintain my pilot's license and I take care of myself. But I was introduced to Symbios, and she uses neuropuncture. She uses microcurrents of electricity, basically utilizing the acupuncture pressure points without needles or pins. They're using electrodes. What that did for me was amazing. And I've learned more and more. I almost wish I had a medical background instead of a business. But what you do, you use these things and integrate again to help. So what you're talking about is total body healing. That goes back to what you said earlier, that you
Right.
got to get the whole body, like peeling the onion, I believe you said.
So just as you pointed out that when you have these chronic pain conditions and similar chronic conditions like that, it affects the whole body. So, I mentioned the multiple layers of dysfunction on top of each other. And at a certain point, even if you're using exosomes with the class 4 laser, for example, that takes care of one spot. It doesn't address, the hormonal consequences, the hormonal dysfunction, the testosterone dropping, the the pituitary and the hypothalamus, out of alignment. So that's where things like neuromodulation. And so there's a treatment we use at Symbios called vector therapy, which you could think of as basically electronic acupuncture. So, and specifically, we're looking at correcting some of these imbalances in the nerves. So, if you think about it, a lot of this dysfunction is you've got nerve output, and specifically, we're talking about from a medical standpoint, the autonomic nervous system. That's the part of the system where you balance the sympathetic nervous system, which is your fight or flight response, versus the parasympathetic, which is your rest and relaxation system. In chronic pain, the sympathetic pathway gets more active, and you're not getting enough of the parasympathetic, which is the rest and relaxation. How is PRP going to fix that?
Mm.
You know, it's gone too far. It's affected your entire nervous system at a certain point. Simply correcting an initial injury doesn't fix the rest of the problem. So that's where things like vector come in. So Vector does the full treatment with Vector. We actually do the whole body. So we have a partial treatment, which is lower body. Then immediately afterwards, we do the upper body treatment. So we're affecting the both the sympathetic and parasympathetic pathways. So we're trying to get them back into balance. If the sympathetic is overactive, we need to calm it down. And so we have specific protocols to take that down. If the sympathetic pathway is not active enough, we need to wake it up and basically get that balance uh, restored. So Vector is not just one treatment where we do this all the time. There's different types of treatment we have within there, which again, the common theme is we're trying to get the entire nervous system kind of back in sync, where we don't have one part that's overactive, we don't have one part that's underactive, that we've got it back in control.
I'll tell you what, let's do. Let's take a break for just a second to talk about our partners and let them tell them about what they do. But this is an amazing conversation. And what we're talking about with Dr. Kushwaha is healing the whole body. So we're going to be right back after these words from all of our partners. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. I'm Jim Blythe, and Cedric White,
Sir.
a tremendous sailor who's a minister. I got to tell you, having sat through your counseling sessions, having sat through your training sessions, it's amazing and is a great way to help the military. So people can find out healingthinehearts.org.
That's it. That's it. And I love what we do together, Jim. The ability, our heart is to provide help, hope, and healing to as many military veterans and civilians and their families as possible. But the ability to work together, that's what makes it worthwhile. And I'll even go as far as Dr. Kushwaha was talking about the vector, right? Dr. Ashmore allowed me to have access at my home, one of the vector units, for over a couple of weeks, and I've got a knee issue, I got back issue, and I was at a point to where I had to have a brace on all the time. I had to have the patches on all the time, and within a couple of weeks, I'm testifying, but within a couple of weeks, it made all the difference in the world. And still to this day, I don't have to wear my brace as much. If I know I've got a heavy day ahead of me, right, I put the brace on, but there's still a level of what I feel like was regenerative healing that happened from that vector unit. So it's definitely worthwhile.
Well, one of the things I found, Dr. Kushwaha, and you can comment on this, is increasing the oxygenation of the blood flow. You're also increasing the fluid that lubricates your knee, and that helped me more than anything else. And I'm not ready to run a marathon, but I can do things, and I'm still active, and that really helps. But I think the most interesting thing is when I went through my first round of treatments, I was amazed at the conversations that I had. Guys who had been severely injured in the military, one guy who had been severely injured in an automobile accident. And he had a plate in the side of his head. I mean, he had a scar that would scare most people to death. And I think that all of this helps to heal. Symbios has seen over 5,000 patients, and now they're expanding with Symbios Plus. And I believe that you are going to be heavily involved with Symbios Plus, Dr. Kushwaha.
That's correct, I am.
Talk a little bit about what you're going to be doing there.
So basically, we're expanding the type of services that we offer there. So Symbios traditionally has done vector for kind of balancing this neurodysfunction, and they've done psychiatric evaluations, counseling, but and of course traditional psychiatric medication support. But beyond that, they hadn't done a whole lot specific for other types of psychiatric conditions, and that's what Symbios Plus is designed for. It's to give more treatment options for specific behavioral health issues. Um, Vector helps a lot of these treatments just by kind of balancing things, but many times we need something, uh, other treatment options. There are people who do not respond to one type of treatment. That's why it's better to have others as well. So Symbios Plus will provide TMS, which is transcranial magnet. So it's kind of like using magnets to redirect blood flow to the brain, to rebalance activity to the brain. So you may be familiar with brain scans where you can see different activity levels in the brain, where you see certain areas that are, relatively depressed, certain areas that are overexcited. With TMS, we're able to do basically a quick mapping where we can see the different areas, what the activity is, and then come up with the treatment protocol where we basically rebalance that, not with shocks or current, not with drugs, but actually with magnets, so we can have kind of the same type of end results in a painless. Because the magnets, just like the vector, you don't feel vector shocking you. Uh, you don't
Yeah, the
feel the
microcurrent are so low. I
right.
had a great experience a number of years ago that I was invited down to Waco, Texas, to the Center of Excellence for the VA, which has a research facility in Waco. And they are using this machine that you're talking about. And it was built, it was the original one, I think was developed in the United States or England, but they Israelis had developed one and it looked like the old style hair dryer for women, and would go to the salon.
Right.
And I saw it, and then they showed me some video of, for instance, a guy with Parkinson's no longer shaking and how improved health. And I think this is something that is great because you're really focusing on area of the brain. For instance, another thing, I'm helping a family right now, and he's got severe dementia. This brain mapping and this protocol that you're talking about with that, I don't know how to explain it, neuroelectronic, magnetic, whatever, it has an effect on a lot of people. It works.
Absolutely. And and again, not everybody responds to every sort of treatment, so that's why we want to have different options available. So that way, because the end result, we don't care what one particular treatment does. Our goal is restoring balance, restoring function, and getting people better. And there's more than one way to do that. And everybody's different. So we need to recognize that some treatments are going to be more effective with certain people than others. And so we're not trying to push one particular treatment. We want to find what the best treatment is for any given individual.
And that's so important because, and I'm going to make a statement that probably I'd be criticized for, but unfortunately, a lot of doctors, the first thing they do is just start throwing pills at the problem. And many of those pills, because I had it done to me a number of years ago, and quite frankly, it messed up one of my kidneys a little bit, not a little bit, a whole lot. And being treated by the vector, believe it or not, I've returned to 100% kidney function.
Yeah,
And
absolutely, that can happen. When you think about a lot of these medications, because what I was mentioned about the TMS, we do a mapping first before we do any treatment. And you may not realize this, but with the vector does basically a diagnostic setup first. That's why when you set up, it's doing a little test first.
right.
It's doing its own little feedback loop to see what the best basically sequence is going to be for you. So there is this evaluation that's done with each of these modalities to figure out, okay, how are you going to respond? What way should we go? When we're doing medication, we don't do that, do we? It's like,
No.
okay, let's try this. Let's try this pill. And then we
But
wait.
you
Okay,
don't
how do you
know.
feel?
Yeah,
Right.
you don't know what's going to happen.
Right. It
So
may be good, it may be totally wrong. When I'm mentioning it as far as the vector, when let's say the sympathetic is overactive, well, we got a specific treatment to get it back under control. When we're talking about medication and there's no baseline assessment, we just know, okay, this person's depressed. We don't know exactly what the different neurotransmitter levels are. We just know, okay, clinically, you're depressed. Here's an antidepressant. It may be that we're actually making this dysfunction worse because we're increasing a neurotransmitter you already have a lot of, but we ignore a neurotransmitter that you don't have enough of, and you feel absolutely terrible on this medication. And we don't have a good way right now of trying to figure out, okay, what medication do you respond best with? So it's not to say medication have no role. It's just that we have a very poor system of trying to figure out what a given person needs from a medication standpoint.
So, Doc, let me ask you from the perspective, because this, having experienced it myself, I know it. We get great results. But let me ask you, for the listener that's out there that has a question, says this all sounds good, but how does this tie in with my VA benefits, with my insurance? How does that? How do you guys work with a person's benefits to get seen by you, to get the benefit, the treatment?
So both Symbios and Symbios Plus are within the VA community care network. So if you have VA benefits but no commercial insurance, you just need a referral to see us, and we can do our evaluations and treatments. If you have, we also take commercial insurance. If you have, um, your standard Blue Cross Blue Shield, Aetna, Cigna, all the major ones, we take those as well. So if you got a PPO, you can see us directly. If you have an HMO, you'll need a referral from your primary care doc. And Symbios will actually start taking on patients as primary care providers as well, which will make it a little bit easier, making sure that you get all the treatments we use. That's part of what we're trying to do, or we're trying to
Wonderful.
encompass more, different, basically trying to make it more a one-stop shop.
Right.
Well, one of the things, again, as a volunteer with Symbios, I'm pretty familiar, and everything is done under medical supervision. This is
Absolutely.
not, this is, and when I say medical supervision, I'm I'm sliding, I guess, a lot of chiropractors, but they're not MDs, they're not medical doctors. And under the requirements by the FDA, the vector is improved, the machine that we talked about, electromagnetic, is improved. Everything we do is approved by the FDA, which means it's safe for use, but it also has to be done under medical supervision. And
Absolutely.
that's where you come in, Dr. Townsend comes in, other doctors come in that are part of this team to make sure we're not just handing you a pill and saying, hope it works.
Right. Let's see what happens.
Yeah.
So
Yeah.
that's absolutely correct. So we have all the machines that we're talking about right now are FDA cleared, so that they have that stamp of uh, proven safety. Um, and we have basically the trained staff that take care of this. These are all licensed individuals. We have psychiatrists, MDs, nurse practitioners. We have certified counselors for, we don't have people just off the street uh, doing stuff. Everybody is a professional in what they do. They've done it for a while, and now we're all working together to create a common goal here.
Now, how can we get a hold of you, Dr. Kushwaha? What is your email um, that you can give out to people, please?
Good question. Let me
Lone Star MD.
Well, why don't you give out the Lone Star one? Because I'm not sure you've got the Symbios one
I
yet.
do. It is It's either Dr. K or Dr. Kushwaha, Dr. Kushwaha.
I'll tell you what, I'll make it easy. Y'all just get a hold of me. I got his number and I'll get you connected with Dr. Kushwaha. So I'm Jim at symbiosccn.com or Jim at veteransimpactshow.com. That's easy to remember. Veteransimpactshow.com. Look us up. I will connect you with Dr. Kushwaha and the Symbios team, Symbios Plus, and you're going to get a chance to learn about all of these modalities and all of these things that are helping people. And I again, I sat in a treatment room of all of these lounge chairs being treated. You never feel it. And yet the conversation, because every one of them in there was military, every one of them was a veteran, as well as now Symbios and Symbios Plus is treating first responders, treating people with commercial insurance. We've opened it up. That was one of the things that I really pushed was to open this up to make it available to everybody.
I'll say the treatments. I'm a big chicken when it comes to needles. I hate needles with a passion. And when I found out that there were no needles involved, right? Even the vector treatment, right? No pain at all. It's like, okay, sign me up. And the fact that again, the results from it were very positive. Then I'm a big proponent of vector and symbiose.
I am too because I've seen it and I've had friends do it, and most of the time, occasionally, you've got a chronic condition. This is my experience. Please correct me, Dr. Kushwaha, but my experience of friends that I've sent, I'd say 90, 98% have had some help. In some cases, they go, well, I'm sleeping through the night, but I still have this pain. You're sleeping through the night. Yes, you weren't before. That's a big improvement right there. And one of the things is that our program goes around the world on internet TV, on a DBTV network. We're plugging in with the Unplugged network. You can look us up on YouTube. We just did a clinical trial in Miami with the ladies. So we're not limited to Texas or Dallas Fort Worth. We can, right now is where we're based. But let me tell you something. We have helped people in other parts of the United States, and we are community care approved throughout the United States. It's important, though, that you will be able to connect with a doctor like Dr. Kushwaha or some of the other doctors that we have on our team. John Townsend is one. And the lady that runs it, she's a Marine. Let me tell you, you don't mess with the Marines. You served in the military, Dr. Kushwaha. Did I understand that correctly?
So my wife did. So I'm
Oh, your
technically
wife did.
military dependent. Yes.
Yeah. So what did she do?
Air Force. She was actually a physician with the Air Force.
I've got a number of close friends that were physicians with the Air Force. And I got to tell you, they do a great job. They do a great job. Navy doctors do a great job as well. So, again, what we're talking about is helping total body healing. Now, one of the things I learned, and please jump in and correct me because you are a doctor and I'm just a business guy, but it's not a cure. You're going to have to, they go through the investigation, they go through the testing, they do it, but then there needs to be a maintenance program follow up depending upon your body, correct?
Correct. So it depends on what the underlying condition is. We certainly have had patients where we go through the full treatment protocol and we get very nice results and we have lasting recovery, but that's obviously not everybody. And
Right.
for most people that have had literally decades of chronic pain and other issues, sleeping through the night is a big win right there because that didn't happen before. And it's going to take more treatments, going to take more time, but there'll be more progress.
All right, we're going to take another break, and then we're going to come back to bring this program into the dock. This is Jim Blythe and Cedric White. We're interviewing and talking with Dr. Kushwaha, and I got to tell you, this is fascinating. But if you've ever had any health issues, let me tell you something. Knowing about treatments that are not pills, not needles, not pins, not surgery can mean a whole lot. Plus, it can work where you've got a really, really chronic or an injury situation where you've got to have surgery. It can do a lot to heal. This is Veterans Impact Show. We're here to help you heal. We'll be right back.
Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
Welcome back. I'm Jim Blythe with Cedric White. Cedric, you're being a little quiet today.
Well, I'm intrigued, and I love what I'm hearing from Dr. Kushwaha. One of the questions that's coming to mind is how receptive are people when you start talking about alternative treatments from what we're used to, right? Again, Jim, you talked about how we're used to getting the pills, we're used to getting the treatments where we're being cut on, so forth and so on. How receptive are people starting to be to see that there's a better way, an alternative way, and a more longer lasting way? How receptive are people, Doc?
So it all depends on expectations. So if you've been through the whole bit with chronic issues and the traditional stuff hadn't worked, they're very receptive.
Yes.
Because they're just in fact they're ecstatic that we have something that can offer them.
Mm-hmm.
If we've got somebody who's right off the bat has an injury, has a condition, generally we don't see them that quickly. So because we may have other treatments that can correct the problem. But once they've kind of been through the first course of seeing a bunch of specialists, being offered a bunch of surgery, or heaven forbid actually having a surgery that's unsuccessful, and now you made a decision that can't be undone. Once a surgery goes bad, there's all kinds of complications that will come with it that we cannot undo. So once you've kind of been through that situation, yeah, they're very receptive because we got a treatment that makes sense. We're using treatments that are all, these aren't things we just made up. These are things that we have decades of research and data to support the treatments that we do, and that's why they're FDA approved or FDA cleared, depending on the treatment that we're using.
I'll tell you, my problem started with my knee over 10 years ago, and about 2018, my doctors from a certain organization started talking knee replacement, and I told you how afraid I am of needles, surgery, and so forth and so on, right? And so when I met Jim and met Dr. Ashmore, and they started talking about an alternative way to treat this pain, I was very, very, very receptive to it, and the end result is really what truly matters, right? It's one thing to try a different treatment; it's a whole different ball game when the treatment is actually effective. Again, I mentioned my wife a moment ago, but she'd be on me if I looked like I was going to miss the treatment. She's like, "Are you going to get on the vector?" Right? Because she saw the difference, and that was a wonderful thing. I wasn't the only one experiencing the difference. She saw the difference in how I was walking and how I was moving, made all the difference in the world. So I'm saying that so that people who may be a little hesitant, maybe so used to traditional medicine, may want to give this a chance because it made a difference to me. So,
well, let me just tell people how to get to it.
yes,
Go to Symbios, Symbios, CCN.com. That's symbioseccn.com. Look it up on our Veterans Impact Show. Look it up on veteransimpactshow.com. They're one of our sponsors, and they're a sponsor, and I'm a volunteer because they've saved my life. And I've talked to many people not just one or two. Now, I've also sent friends there that had conditions that were so chronic that it helped a little bit, but it wasn't overnight. So some people were affected first treatment, second treatment. Some people weren't affected after 10 treatments. And with that, the amazing thing of Dr. Ashmore, who is a PhD, not a medical doctor, but brilliant, changed up the protocol and found that something else works. So here's the thing with the vector that they use, there's about 350 different protocols. So it works. And so if you say, what you're talking about magic, you're talking about microcurrents of electricity. Dr. Kushwaha, your family, your name, you go back to India. In the Hindu Vedas, how many thousands of years old is acupuncture?
Many thousands.
Yeah.
Many thousands.
Yeah. Some people say 6,000-year old, Chinese and Indian. And this works, and it has worked. The VA, I had Dr. Klingler on, and they're using integrative medicine with the needles and pins. This is something that has worked, does work, can work, but there's no guarantees on anything. And so you need to see a medical doctor. We've got it, symbioccn.com, and we'll do everything we can to help you. If you're other parts of the country, we're working to build up so we can have a clinic in your town someday. So I got to tell you, this is a great, great opportunity. I so enjoyed meeting you. I'm going to come take you to lunch, and you're in Fort Worth, I believe, right?
No, I'm actually in the Plano area.
Aha, I got the place to take you. A friend of mine owns it. All right, Pastor, take us out with a prayer.
We'll do that. We'll do that. Father, we thank you for this day. We thank you for those who are going beyond the norm, willing to stretch and move beyond the comfort zone to enter into new areas of help, hope, and healing. We thank you for people like Dr. Kushwaha and his willingness to help and heal your people. And we ask that you continue to just give them ideas, visions, and concepts as to how to even move further in the healing of your people. We thank you for this day, and we pray for this nation, Father God, bringing us back as one nation under God, indivisible, with liberty and justice for all. In your name, amen.
Amen.
Amen. Dr. Kushwaha, thank you for being on board.
Thank you for
really
having me.
appreciate it. Tune in next week. We've got another great program for you that's all about help, hope, and healing.